Hi, welcome to Professional Certifications channel. Let's break down RHIA exam preparation, one topic a day for focused and effective learning. Today's topic is Clinical Documentation Improvement, CDI, in Healthcare.
1. What is Clinical Documentation Improvement, CDI? Let's start with the basics. What exactly is Clinical Documentation Improvement, or CDI? Clinical Documentation Improvement is a program designed to ensure that health records accurately reflect the care provided to patients. It involves reviewing and enhancing clinical documentation to ensure that it is comprehensive, precise, and fully captures the patient's diagnosis, treatment, and care. CDI is crucial because it impacts many aspects of healthcare, including patient care, coding accuracy, billing, reimbursement, and regulatory compliance. The goal of CDI is to improve the quality and completeness of documentation so that it accurately reflects the patient's health status and the care provided.
2. Why is CDI important in healthcare? Now you might be wondering, why is CDI so important? There are several key reasons why CDI is critical in the healthcare environment. 1. Accurate coding and billing. One of the primary reasons for implementing CDI programs is to ensure that the documentation supports accurate coding. Accurate coding is essential for proper billing and reimbursement. If the documentation is incomplete or unclear, it can lead to incorrect coding, which can result in lost revenue or even penalties due to billing errors. 2. Quality of patient care. CDI also plays a vital role in enhancing patient care. Comprehensive and accurate documentation ensures that all healthcare providers involved in a patient's care have a complete understanding of the patient's condition, treatments, and progress. This is particularly important when multiple providers are involved or when patients move between care settings. 3. Compliance with regulations. Healthcare organizations must comply with various regulations and standards, such as those set by the Centers for Medicare and Medicaid Services, CMS, and accrediting bodies like the Joint Commission. CDI helps ensure that documentation meets these regulatory requirements, reducing the risk of audits, fines, and legal issues. 4. Clinical research and data analytics. Accurate and detailed clinical documentation is essential for clinical research and data analytics. High-quality data enables healthcare organizations to conduct meaningful research, identify trends, and make informed decisions that can lead to better patient outcomes and more efficient operations. 5. Reflecting the severity of illness and risk of mortality. CDI programs help ensure that the documentation accurately reflects the severity of the patient's illness and the risk of mortality. This is important not only for patient care but also for public reporting and benchmarking purposes, as it can impact hospital rankings and reputations.
3. Key components of a CDI program. So, what does a successful CDI program look like? Here are some of the key components that are essential for effective clinical documentation improvement. 1. Collaboration between clinicians and CDI specialists. A successful CDI program requires close collaboration between clinicians, such as physicians and nurses, and CDI specialists. CDI specialists are often trained professionals, such as nurses or coders, who review the documentation and work with clinicians to ensure that it is complete and accurate. This collaboration is key to identifying gaps in documentation and making the necessary improvements. 2. Education and training. Ongoing education and training are crucial for both clinicians and CDI specialists. Clinicians need to understand the importance of accurate documentation and how it impacts coding, billing, and patient care. CDI specialists need to stay up to date with the latest coding guidelines, documentation best practices, and regulatory changes. Regular training sessions and workshops can help ensure that everyone is on the same page. 3. Documentation review process. A structured documentation review process is essential for identifying areas that need improvement. This process typically involves reviewing patient records for completeness, accuracy, and clarity. CDI specialists look for missing information, ambiguous language, or documentation that doesn't fully capture the patient's condition. They then work with the clinician to clarify and enhance the documentation. 4. Technology and tools. Technology plays a significant role in supporting CDI programs. Many healthcare organizations use electronic health record (EHR) systems with built-in CDI tools that flag potential documentation issues in real time. These tools can help automate the review process, identify trends, and provide clinicians with prompts to ensure that documentation is complete and accurate. 5. Continuous monitoring and improvement. CDI is an ongoing process that requires continuous monitoring and improvement. Regular audits, data analysis, and feedback loops help ensure that the documentation remains accurate and that any issues are promptly addressed. Continuous improvement is key to maintaining the quality of documentation and adapting to changes in regulations and best practices.
4. Challenges and best practices in CDI. While CDI is essential, it's not without its challenges. Here are some common challenges and best practices to address them. Physician engagement. One of the biggest challenges in CDI is getting physicians to fully engage in the process. Physicians are often busy and may view documentation as an administrative burden. To address this, it's important to communicate the value of CDI to physicians, showing them how accurate documentation supports patient care, reduces their risk of audits, and improves overall outcomes. Balancing quality with efficiency. CDI programs need to strike a balance between improving documentation quality and maintaining efficiency. Overly detailed documentation can be time-consuming and may not always be necessary. The key is to focus on capturing the most critical information that accurately reflects the patient's condition and care. Keeping up with regulatory changes. Healthcare regulations and coding guidelines are constantly evolving, which can make it challenging to keep documentation practices up to date. Regular training, staying informed about changes, and using technology to assist with compliance can help manage this challenge. Standardizing documentation practices. Variability in documentation practices across different providers and departments can lead to inconsistencies in the quality of documentation. Standardizing documentation practices, using templates, and providing clear guidelines can help ensure consistency across the organization.
Conclusion. In conclusion, clinical documentation improvement is a critical initiative that impacts the quality of patient care, the accuracy of coding and billing, and the overall success of healthcare organizations. By implementing a robust CDI program that includes collaboration, education, technology, and continuous improvement, healthcare organizations can ensure that their documentation is accurate, complete, and compliant with industry standards.